For the purposes of the recorder, this is Revitalizing Recovery Experiences in a Nurse-Led Holistic Wellness Pilot Program for Women in Sober Living, and my name is Beth Delaney. Thank you so much for being here. The microphone helps me, which is so great, right? You guys, I have to make a confession, and I'm going to tell you just a little bit about my background. But my confession is, I've been a person who's hearing impaired for a very long time, over 20 years. It runs in our family. And today was my very first professional day where I forgot my hearing aid charger. So I have a moderate to severe impairment. So I'm just asking you to look at me, because I can supplement with lip reading pretty well, but I apologize in advance for if I have to ask you to repeat something. So I'm super duper excited that you're here. I'm excited to tell you about what we did in a small little community and a small organization, but it's leading to exciting things. My background is I've been a nurse practitioner and a nurse leader in the cancer space, hospice, and palliative care arenas for over 30 years. I worked at a large trauma center in Dayton, Ohio. I worked at Ohio State at the James for a period of time as a director for palliative care. I had a season where God called me to be a professor at Cedarville University for almost a decade. And then I was in an outpatient clinic taking care of patients, doing palliative care and supportive services. So then, after almost 33 years, and I feel like our speakers this morning, when they've led with how the Holy Spirit has led them, that's what happened to me. The reason I'm standing here and interested in this topic is that I'm a daughter of a person who had alcohol use disorder and unfortunately at one point completed suicide. And then I met my knight in shining armor, who maybe if you went to any of Pastor Greg's sessions, we were high school sweethearts, and we got married in high school, and we didn't use alcohol, and probably there was part of me that said, hey, that guy's a church boy, probably not going to repeat what my mom and my brother and I went through, which was pretty not great. And then about 10 years into our marriage, then alcohol became part of his amazing global career as in the IT sales arena, and then as using alcohol as part of when he would get trips and part of the business deals, he realized that alcohol could numb pain. And we all know that most oftentimes people that are struggling with substance use disorder are trying to address their pain, a physical pain, a mental pain, a spiritual pain, some kind of pain. So we found ourselves as a family in the throes of a 15-year struggle with alcohol use disorder. So my children, so I'm a spouse, a family member, and a daughter of people who've struggled with alcoholic. Ours was alcohol and mental health issues. So the reason I'm standing here is after all that stuff in the world of oncology and as a nurse leader, God said, okay, now you're taking all of that experience, and I'm going to put you in 3 nurse entrepreneurial startups, and we're going to see what happens. I'm like, say what? And as I was explaining to the ladies, when you know the rhythms of the Father, and you learn the rhythms of the Father in your life, you know, you might be sad for a season, because I kept thinking, oh no, I'm going to be a chief nursing officer at OSU for the rest of my life. And he's like, yeah, nope. Surprise! I'm going to be a professor at Cedarville University. Nope. Surprise! And so it's all good though. And you know what? Just like our speaker said this morning, his ways are far better. The things that he has put are so much bigger than I could have ever imagined. So I'm so grateful. And so of those 3 projects, this is one of them. And so I'm going to tell you just a little bit. But before I do that, I know part of it. Oh, Greg made me fancy. I think I can use this clicker. Oh, yeah. So I learned a little bit when people were coming in about, I know a little bit about Lillian, where she works. I know a little bit about Crossroads. Debbie is here as a volunteer. I don't know if she's here. She's here because she's doing the room, or she wanted to be here before the topic.
I'm also a nursing student. So.
Nice, a nursing student. Excellent. Rachel, where are you from?
I'm from Portland, Oregon.
Yeah, I'm sorry. Where do you work?
At Good News Community Health Center.
Good News. And what do you do there?
I am the nurse manager.
Excellent. And you guys came in as a group. Tell me about where you're at.
Bethany Center, South Carolina.
South Carolina. What city?
Bethany, Greenwood.
And what kind of, Choose Well? Is that your? No? What's your organization?
Bethany Center.
Bethany Center. What do they do at Bethany Center? Family medicine clinic? Okay, great. And then we see the social workers of the world. Suhain? Not bad. In Philly? Oh, my best girlfriend lives in Philly.
Yes.
Where are you from?
Runs a health center.
Nice.
And
And what do you do there?
Behavioral health consultant
Okay, behavioral health assistant.
and consultant, and we also have a Suboxone program.
Ah, my people, yes. Thank you for being here. Tell us about your organization.
I'm from Lawndale Christian
Okay,
and do these.
Illinois.
Illinois, Lawndale Christian in Chicago.
Yep,
And I am a social worker in our substance use disorder clinic.
excellent. My brother Warren, tell him where you're at.
So I'm going to be in Los Angeles, California, and doing family medicine and addiction medicine.
Nice, nice. And tell me why you're here, friend.
I am a medical student in Birmingham, Alabama.
Excellent, thank you for being here. Oh, you guys just came in. Linda?
Yeah.
Milford, Ohio, hi.
Hi.
What brings you here, or what organization do you work at? Together.
Yeah, we both work at Crossroad House.
Excellent. Excellent. So you guys, thank you. Now, I'm thinking, based upon what we just said, I think every one of your organizations does have nurses, correct? Yes, 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 yes. And the reason that that's important for this particular discussion is, in my community in Dayton, Miami Valley, I don't know about where you guys are, but there are a lot of sober living facilities, recovery houses kind of coming up, and they range from 2 beds to hundreds of beds, but many of them are in that 2 to 30 bed kind of range, or 25 bed range. And I'm finding in my little travels that they don't have any nursing staff. They may or may not have as much structure as what I'm used to in a large hospital system. So that's why I was curious about where all of you guys were from. So I want to tell you a little bit about her story. Her story is a little house in Xenia, Ohio that has 4 beds. And it was a dream of a person she was actually a children's services worker, had her master's degree, who contacted my husband and said, I've got a child that I'm taking care of, and their mom needs recovery. And they couldn't get any recovery services for days for this mom. And she felt like the Lord put her on a mission to do something called contemplative housing. Contemplative housing in our world is from the moment of contemplation. If you just think you might want to get in a recovery journey, we're picking you up off the street. And so her story began really services in 2018 in Xenia. And you'll see some of the stats from there. But last year we served 61 individual ladies in our little house, and that was 10 more than the year before. But we had a partner organization called Safe Harbor House. Let me see if I can do this and be fancy. Yes. Safe Harbor House and her story. Safe Harbor was a sober living facility that was in Springfield, Ohio, just 15 minutes down the road, that had been established for over 11 years. And we were partners, so we were like-minded agencies committed to a faith-based approach. And over time, we worked together so much that in January of this year, we merged. So now, her story is the organization. From the moment of contemplation, women have the opportunity to stay in the continuum of care for up to 18 months. Between the 2 houses, this client-centered recovery care, housing, support through appropriate detox, case management, transportation, social work, sober living, integration of life skills. We also now have outpatient mental health support. And what I want to talk to you about clearly in this particular presentation is a body, mind, spirit approach, which is why Crossroads in Ohio, I'm like, those are my people. We need to talk to them. So in 2019, people from the board, so remember my husband helped with the person who founded Her Story. Some of the board person came to me and said, hey, we'd like for you to join the board. And the Lord had said, yes, you're going to be on the board. I'm part of this group for a while. I'm like, okay, right, whatever. And I knew he was doing that. So I ended up being the board chair from 2019 up to 2022. And we had this mighty, powerful group of women, social workers and nurses, who led Her Story in their beginning years. But all of us as healthcare providers, we wondered, what would happen if we added purposeful wellness strategies from the moment of contemplation and we wove them in throughout the continuum of a wellness or recovery journey? And so at the end of 2022, a lot of things were happening, and I said the Lord was making that way to lead. I stepped down as the board chair for Her Story and became the chief wellness officer. And what we set on task to do was this pilot program. And the pilot program began with literature review. The references are at the end of the PowerPoint. The PowerPoint will be included in the information on Wahova. But oftentimes, and you guys tell me if this is true for your organization, the literature talks about the role of the registered nurse in the recovery space as one typically focused on detox medication support, detox medication side effect management, and that's really much of what nurses do in recovery programs at the time that I reviewed the literature, which was about a year and a half ago. Nurses often work to distribute medication. They support adherence to medications. They like their work. And if you look at that bullet right here, what's not in the literature is the non-pharmacologic support provided by registered nurses. And this person studied that it was actually not in the literature, saying, was there an expanded role of the registered nurse out there that we weren't taking advantage of? Also, especially since COVID, we've learned about, you hear more and more about wellness integration into our healthcare system. But because of my time in the healthcare system, I just remind everybody when we talk about this body, mind, spirit approach. 80 years ago, that was the norm. Let's not forget that. It always used to be body, mind, spirit approach. Then we had a season of our years in America where science had an explosion, and we kind of started to silo a bit. Mental health, physical health, spiritual health, and they were separate. And this becomes key when I talk to you about what we found in the pilot program. So here's what we set out to do. Oh, wait, I can't leave without my people. So this is taken at Safe Harbor House in Springfield. So I joined the team like we officially talked about it in January. I started work in February. And by April, we had a MSN student who I was her mentor, and then a DNP student who I used to work with at Cedarville University calls me up and says, hey, Beth, I heard you're working at Safe Harbor. You got anything I can do? I'm like, come on. And then April is a retired registered nurse that I used to work with at the hospital that I worked with for many years. So this was our core of ladies. We worked 2 days a week, at 1 day a week at each house. So Mondays we'd go to Safe Harbor, Tuesday we would go to Recovery Beginnings. Recovery Beginnings is the first phase at Her Story. So when I talked about the women coming off the street, I'll refer to that program as Recovery Beginnings. So that's RB. Recovery Beginnings is that first walk in the door phase program. And after discussion, oh man, I'm getting too excited. This is what we set out to do. We wondered, what if a registered nurse focused on from the moment of contemplation through recovery living, educating the client first that at this organization, we're going to use a body, mind, spirit approach. We purposefully included that in our introduction. So when a client came in, they met with the nurse within the first week. Every time a new person came in, we saw them the next time we were at the house. At intake, in this ambulatory setting, what if we reviewed the client's current medication list, their current adherence, their understanding, the need for refills, and their translation of anything health language that they didn't understand, right? Because when you're taking women who are in a substance use disorder journey, many times they have let their medications go. They don't even have somebody to prescribe them. They don't even remember, because a lot of times if they were safe, so we screen them to see if they're appropriate for our level of care. But I have people who were on meth in our house. We didn't have too many alcohol folks, not for the first couple of days because we detoxed them medically. Cocaine regularly, opioids, marijuana, all different types. Last year in our data, of those 61 ladies, meth was our #1 drug of choice. And so getting them right on the jump, tell me about your medicines, why do you take them? And eventually, by the time they went to a sober living situation, we thought, what if we could empower them and they actually could tell the provider about their medicine? So we had like a long-term goal and a short-term goal related to medication. We also wondered, as soon as they were clear enough to tell us and or get them scheduled quickly to primary care, a mental health provider, an OB-GYN provider, and a dental provider. And what ended up happening was we found out that also our local public health department was providing services related to HIV, Hep B, Hep C, TB testing, and offering treatments for STI. So we made that a part of our registered nurse intake, okay? And what we watched, as any of you who have worked with people in recovery, when they start to get away from their substance, right, they're better. But I'm telling you, I watched resurrection in 3 weeks. I was there on days when women came into the house, and when we got them within 24 hours to the primary care person on appropriate medications, screened and treated their STIs. Did you need something? No?
Getting a head count. Sorry.
Say again?
Just getting a head count.
Oh, thanks. I couldn't even believe it. I couldn't believe the change in the overall look of the person. And I'm going to talk more about this, when we got them on their comorbid condition medications and their mental health medications / recovery medicines, the quicker they interacted more, this is not rocket science, interacted more in their IOP programs, mental health counseling, case management. So what we found is getting it done sooner and quicker really led to their ability to participate into the programming better. We also wondered about what if we initialed weekly, battery's dying, weekly, from the moment of entering the program, evidence-based, informed wellness programming with appropriate health literacy. So that was kind of our intervention. We had the wellness class and the medication kind of component with the connection to community. Those are the 3 main components: wellness class, medication support, connection to the community. Eventually, in the sober living situation, we wanted to educate our women in sober living how to interact with the healthcare system, and then we wanted to introduce them to the concept of patient portal, and then use the patient portal so that we could help them see their primary care list of diagnoses, and then individualize their wellness activities toward the primary care list. Are we tracking? Right? Okay, so that's what we set out to do. Here's a few statistics from our little small sample. So in between March and July of 2023, we had 33 possible clients in our program. The age range was 21 to 60. Did you hear me? 21 to 60. The mean age was 38. 100% of them, unfortunately, were homeless. All of them were 200% below the poverty line. Of those 33, 2 left AMA within the first 24 hours, and 1 was dismissed to a different level of care within that first 24 hours. Excluding these 3, 29 of 30 were seen by a registered nurse at least once. So that was a victory for us, 97% on a brand new pilot program in the first few months. So just the fact that we got the visit accomplished made us really happy. Then we were able, in our little tiny pilot, to create 63 individual community connections, like those connections to primary care and dentists and all that. 63 individual ones of those 30 clients. Now, what is exciting to me about this, because we didn't know what, you guys, we were just totally taking a shot at this. Could we get it? It basically said, we helped 60% of the clients get to a community connection of a healthcare provider. And we surveyed the staff and the case managers and said, okay, since we've been here, do you notice any difference in how our clients are getting connected to services? And this is what they said. There has been a significant increase in the number of primary care visits and the consistency of the visit scheduling. Before we did this effort, they would eventually get to primary care, but not always and not early. If you look at this, so 60% is great, but that's still barely over half, so 40% gave us something to shoot for in our next phase. Now, the other thing that we as healthcare providers, so as nurses, we're very interested in, so what have I learned in my career as a healthcare leader and innovator? You got to know your community. You got to get out there. You got to find out. My mission is always collaborate, don't duplicate. And if you can support and strengthen another organization in your collaboration, that's even better. So there's no reason to take limited energy and resources when you can just fill in gaps. So in our little pilot program, we were able to strengthen 14 community connections to our little house in Xenia, which then led to Safe Harbor. But that included pharmacies, primary care, OB-GYN, FQHC, a homeless shelter, a dental office, and an exercise program. So I wanted to share an example with you about the wellness class. So we created, our title is called For You Wellness Wisdom. For You Wellness Wisdom. This is what our sheets look like. We've since created almost 30 classes. And the topics were decided based upon assessment from the staff and clients, as well as from the literature of what topics we actually included in the weekly wellness classes. This handout is called Calories, Fat, and Carbs. What we did was use this one handout sheet format, and we would, one of the nurses, the retired nurse that's been the APRN, she would do the first brush of the literature. We created the template because we thought it was fun to look at. We tried to put appropriate pictures on it. But you can see that's not a lot of words for a 1-hour class, right? But I will tell you, it was plenty to engage in a conversation. And basically, here's how the class go. We'd sit around the table. The women would come to the class. We would take turns. And they would each read a bubble. And then we would discuss the bubble. Before the class started, we would say, what were your health goals last week? Did you meet them? We would go through the class content. We would go around the table again and say, what one thing did you learn? And what's your goal for next week? And on the back of every handout were the references of literature, of where we pulled the information, and then a place to put what I learned, what my goals were, what my progress was, and what my goal would be for next week. Then they could keep those sheets. We had a little binder, and they could keep all their wellness class stuff in one spot. What we loved about this format was that it worked. It really did stimulate conversation. It did change the culture in general of what was happening, at least on the topic of health in both houses. I'll tell you more about that in a minute. But it was fun to do. These are our stats. Again, our little tiny intervention. We had 53 clients that participated in our classes, 53 individual clients in the class together. Total number of clients in class at Her Story was 15. Total number of clients in class at Safe Harbor was 38. We've started to realize that the early recovery people really resonated with a certain set of topics. So this is the sheet that we give out to people when we talk about just our class in general. For You, Wellness Wisdom Program Components. A new way a nurse might help. These are the elements, these are our current topics. But back to getting people on their medicine and connected sooner, we quickly learned, I would say quickly, 4 months, that if we went through the topic of how does addiction impact your health, how to read nutrition labels, the importance of water, walking, stretching, and sleep, they became our rotation. Because people are usually at recovery beginnings 4 to 5 weeks. We just found out that those 4 to 5 topics resonated with them in the place that they were in their journey, and it worked. And so once we got them sleeping, I can't speak enough, drinking water, walking, and sleeping, it added to the game change. And it was like, when we had times where we had them on the proper medicine, seeing the proper people, getting their comorbid condition medicines, water, walking, it shouldn't be that exciting, but it really was. Because they would come to you and say, I just feel so much better. And you're like, yep. And it was so fun. So I told you my history. I told you what we did in the pilot. This is what I was surprised about, given my frame of reference and experience. The age of the clients. Okay, so I think that there's a misperception, unless you're in this space, that people that are in recovery programs are teens, 20s, 30s. Wrong. In my experience, did you see that? 21 to 60. Now, my professional experience with cancer, palliative care, and hospice, when people are like, Beth, why don't you just be a nurse practitioner over here in the recovery space? I'm like, whoa. Yeah, I'm trained as a family nurse practitioner, but I've been in really mostly palliative care and supportive services. Little did I know that the translation of my experience actually fit way more beautiful than I expected, because the age of the clients and the numbers of multiple comorbid conditions, such as COPD, diabetes, and obesity, were so regular that is when I really realized, especially our diabetics and if they had COPD, asthma, those medicines are critical for them to be able to focus, like not being able to breathe, not being able to have their inhalers, not having their blood sugar monitored. So I was surprised at how much of that I felt like I was still in my old clinic, and I was in a recovery space. Here's the other thing. I see these silos over here. I told you in the beginning that I was going to talk to you a bit about silos. I was so surprised about this. When I've walked into the recovery and behavioral health space, so help me ladies, social work space, I've always been in a place where, sorry, as a nurse, my opinion was always valued, right? I mean, I didn't realize I was taking that for granted. So after we had these results, and because of the work that my husband and I do together, I started asking leaders outside of our organization in all sizes of recovery, like bigger organizations, leaders that I knew that had been in the place with middle-sized organizations, what they thought about this. And a common theme was, like, nurses aren't really part of that behavioral health team. And if you are in a place where they are, that's awesome. But I'm surprised by, I don't mean this bad at all, but there's unequal across the behavioral health roles even, and of how things are decided, and always maybe not in an interdisciplinary plan way. And so that's just my observation. It's not bad, it's just the way it's been forever. And so it surprised me, right? I just wasn't used to that. And so I feel like because of the level of complexity that our clients are right now, we have to figure out how to break down our silos, especially between physical, body, mind, I would say spirit, because I believe our clients are so complex, it really does require that approach for them to have, I guess, the best opportunity to really have, I think, longer term success in their recovery journey. The other thing is, I heard firsthand from our ladies how much stigma and how much fear they had from healthcare providers. And it made my heart sad. I literally watched a lady at Safe Harbor who I had prepped for the appointment. I coached her. It was a partner. And she was not excited about going because she had been treated so poorly by providers in the past. I happened to be there when she got back from her appointment. She ran in the front door crying and ran up the stairs of the sober house and wouldn't even come down because it was a nurse practitioner treated her so poorly because of her history of addiction. I just didn't think that happened anymore, and I was wrong. So our need to get out there and champion and educate is absolutely critical. And empower the people in recovery that there are a lot of healthcare providers out there that are going to treat them with respect and dignity, that not quit. We just have to find the right one. I can't underestimate or overstate the need for appropriate health literacy and education and training when we talked about this wellness evidence-based approach. I could talk more about that, but I don't because I want to have discussion. And I really believe, and this makes me sad kind of, but because of being in this space with my husband, he's been in long-term recovery since 2008. Thank you, Jesus. And which has been amazing. But so when he would start, there were lots of folks with just these beautiful, big hearts that would just invite folks in to just live at their space or start a sober home, and not necessarily training or licensure, but just super well-intended people. And my observation is that our people are so complex now that that's going to be hard to even do. And I'm not disparaging, I'm just saying that I believe the need for training for folks that are working in the places that I'm in is really, really important. What are the challenges? Okay, I've been a leader for a long time. I'm going to tell you the bad with the good. Here's the bad. So at the time that we started this initiative of the pilot program, everything financially at our organization looked great. We did our due diligence, but we ran into a season of grant delays, billing delays, credentialing delays, and I was expensive. I'm just being straight. So it wasn't, even for that little bit of time. So fiscal challenges were very real, and I'll tell you that, but there's a happy end to the story. Learning how to best bill for our services, journey, right? So what we ended up doing in Ohio, a nurse can bill in 15-minute intervals for health education and medication education. So what we did, we can build a group note for health education and medical education, and we can bill an individual visit for those two topics, which actually went beautifully with our initiative. So our registered nurses, under the Behavioral Health Code, as I currently understand it, I'm a rookie. I'm telling you, I'm a rookie. Can bill for services for those topics in those ways. Bullet number 4 here. Yeah, I was not prepared for this, but this was a very real thing. In a sober living situation or recovery house situation, we might be getting ready to have class and something happens in the house and there are people screaming and yelling like all over, and that's just normal. And so here you are having to navigate a class situation when there might be a client screaming at a case manager. So I didn't expect that. It was a challenge. We worked through it. But it was that could have been on my surprise slide also. But it's something that you have to be prepared for. And then a clear communication between the nurses and the case management / behavioral health social work staff. So that's something that was evolving over time. We were also worried about appointments. So sometimes that didn't go well. We were working with them on about appointment. The case manager was working with an appointment. The social worker recommended behavioral health, and we weren't talking. So that caused us to have a period of stress. So please learn from my challenges so you don't do them. What's the exciting news that I'm so happy to tell you today? So in the challenge, the fiscal challenge, I'm just telling the whole story. I went on furlough, but believed in what we were doing, and since we had student nurses, they continued on. And I wasn't quitting. I'm like, well, we just got to find different funding, and I got to figure out this billing, and we have to quit the delays, right? Well, as God would have it, let's say that again, as God would have it, He orchestrated conversations when I was just out interviewing leaders about wellness, which turned into, hey, why don't we put this into a local Itemus board grant? And I'm waiting for the first bill to be paid, but we got funded. And so we got funded from February 1st through September 30th to build the structure and the classes and the policies and the processes with the proper business models so that we could take this and offer it to anybody who wanted it. And so, right? So exciting. So with local leaders' support, and I'll tell you, when I said earlier about it's taking time to have FaceTime with those community leaders, because I'm gonna tell you how good God is again. So in one of the other lanes, remember 3 lanes that I'm in now? The other lane, I'm a lead program evaluator for a middle school and high school prevention program, like behavior prevention program. Never on my radar. 2 schools, 4 years ago, we got funded one time for a pilot program. We're now 45 locations, 3 states, and we have an evidence-informed, now evidence-based, we did the research. And it was that local leader who funded the original pilot, who saw the work that we did in that lane, who I went to just ask her if I thought that I was crazy going down this wellness path. After what was supposed to be a 20-minute discussion, it was a 75-minute discussion, and look at me. She loves Jesus. And she said, because I went to these leaders and I'm like, you know what? It'd be so simple. I could just go get a job. I was just discouraged and I wanted to quit. And her words to me at the end of 75 minutes were, don't you dare quit. And I wanted to cry because I wanted someone who would tell me the truth about, was this worth it? Was this struggle worth it? She said, don't you dare quit. And I said, okay, at the end of our discussion, I said, is there anything that you think is worth funding? She said, absolutely. The whole nursing thing. She goes, I'm going to call my lead person next week. So this was the week between Christmas and New Year's, just this past Christmas and New Year's. And they called me the first week. I met with someone the second week to finalize the proposal. And then we were in and approved by the middle of February. And so now we're in the process of getting all of the proper hoops so that we can start the invoicing. And then she said, that middle school and high school curriculum, I think it belongs in the recovery space too. So let's do that as project 2. So if we had not reached out to a local leader, that part of the story might have been different. Now, what are we doing now? We're really looking back at all of our classes to make sure that they are purposefully evidence-based, appropriate with appropriate literacy. And just like God is so good, he has literally, in this little short window, plopped 3 other resources who are faith-based, people who believe wellness should happen in the recovery space. They literally dropped in my lap. And they're all doing things a little bit different. So Monday at 10:15, we're having our first meeting of all of us. And we're going to all contribute together and build the structure with the Adamus board money that will make it duplicatable. And it'll be way better than if we'd have just done it by ourselves. So good. I just said everything about the business model, and we're dedicated to a personalized, holistic, evidence-informed, literacy-appropriate approach. Now, before I get to the next slide, well, I'm going to go ahead and show you. Out of everything I could say to you, this is the slide I want you to remember because it goes so well. I went back after the speakers this morning and put the last 2 slides in because it'll make me cry again. So in March, when we started the program, like that March, April, that was before all the students and everybody came. So in the very beginning, I was it, like doing the whole thing. But you know what? We're healthcare providers. That's normal, right? And I had this slide. Oh, it didn't show. I'm not going to turn around. Yeah, I am. Look up here. It's tiny. But it's a slide that just shows body, mind, spirit. Okay? That's it. So we made something called, and I have it, I didn't put it up here. We made a guideline for what we would do in a recovery beginnings nurse visit and what we would do in a safe harbor nurse visit. Okay, so remember I told you we had classes and then we had individual client visits. So I have a list that I didn't include in here of what we did at RB and what, yes, you can have it, and what we did at Safe Harbor. And so we followed this list. Why is that? If you've been an educator or a healthcare administrator, you got to have a checklist. You're checking off your people. They have to see one, do one, teach one. So I made the list so that we could train and have consistency in our visits. And so in the first visit, it was about going over the medicines, helping them understand the approach, and then getting them connected like we talked about. Here's what happened. Over that course from March, April into May, I'd be sitting downstairs on our broken down couch in the basement where I would meet them. And it's new now. I'm super excited that we got a new couch in the basement in the house. And I was, like most of the time these women had been in recovery sometimes less than 3 days, like off the street, but less than 6 days because I would have seen them the week before. And so if you've worked with people who are fresh off the street in recovery, that's a cloudy time for some folks. And so 4 times in just that kind of 8-week period, I would just be doing my normal, here's blah, blah, straight through the checklist. I'd flip over to that screen. I would explain that this organization is dedicated to a body, mind, spirit approach so that when you think about the nursing visits, we're going to focus on the body part. Your IOP and your mental health counselor are going to focus on the mental health part. And then we're going to take you to faith-based opportunities for recovery in the evenings, and that's going to be the way that we're going to focus on the spiritual part. If you're interested, there's a Bible study that I'll meet here regularly. So it was just part of like the orientation. 4 times. 4 times. Women looked at me and started crying. And this is what they said. Where have you been? And I wouldn't even know it was happening. And then all of a sudden we'd be talking back and forth, and all of a sudden I would see the tears. And by the 3rd time, I thought, Lord, I'm not quitting this forever because I can see it. I can see it. And we would, and my, you guys have talks that you have with patient or clients regularly. You have like things that you say over and over and over again, right? Because that's just part of our role. And I would talk about, we believe that if we tend to your physical health, your mental health, and your spiritual health quicker together, it's like a super highway to recovery, because many times people might do a physical, or mental, or spiritual. But when you put them all together, I believe there's power. And so this is what will keep, all the other stuff is great, but this is it. And when I thought about what our speakers have been saying, after the speakers this morning, this is what I thought. I always had a dream that when we came into this recovery space way back in 2019, when I thought about her story, I'm like, we can show the world that we can do this the very best. A body, mind, spirit approach is actually excellence. And I don't know if you guys know who Dr. David Jeremiah is, but at Cedarville, he's a turning point out in California. Warren probably knows who he is. He's like a Bible teacher, scholar. Colossians 3:23 is his favorite verse. He talks about it all the time, and I learned it from him to that verse. But the Colossians 3:23 says, whatever you do, work at it with all your heart as working for the Lord and for not, whatever translation, man. This says human masters, but man. And I thought to myself, what if we at CCHF, that's how we did everything? And I believe in the recovery space, from what I can see, with my lens, that's Beth's thoughts. This ain't evidence, this ain't anything, that's just me talking. We have a leader and a helper. We will have favor and guidance. Holy Spirit. We must be good neighbors. Okay. We must be good neighbors. One more time. We must be good neighbors. We must learn the current state in our communities. And we can talk a lot about that. But we're not just like there. Come to us. We're going to fit. No, that is not even close. We must understand the available resources in our community. Again, so we can collaborate, support, maximize, energize, encourage, and we must lead with love. These are the references from the slides at the beginning. There's my email address. Thank you for listening. I don't think I put anything else. That's it. Thank you for listening.